Hi, my name is Abby.
And I'm Bailey.
We are both second year pharmacy students at the UAMS College of Pharmacy. We are members of the American Pharmacist Association in the Committee for Generation Rx. Our goal is to briefly teach you about medication safety.
What are prescription drugs? Prescription drugs require a prescription written by a doctor or provider to be dispensed. Prescription drugs are dispensed only at pharmacies under the direct supervision of a pharmacist. These can be short-term drugs for the flu or for post-surgery, or long-term drugs for cholesterol or blood pressure.
Prescription drugs are not just pills and capsules. Prescription drugs can be tablets, capsules, injections, inhalers, ointments, liquids, patches, and many more. Some common medications that you might associate with some of these are antibiotics, which could be tablets, capsules, ointments, and liquids, vaccines, which would be injections, and inhalers, which could be used for asthma.
What is a prescription? Most of you have probably seen a written prescription like on the one on the left. Prescriptions can be handwritten and taken by the patient to the pharmacy, called in by the doctor to the pharmacy, or sent electronically to the pharmacy.
Prescription drugs are a critical part of treating health conditions and infections. However, prescription medications are only safe when taken by the person it was prescribed for and when it is taken in the correct dose and at the correct times.
Over-the-counter medications are drugs that you can buy without a prescription at most drugstores and grocery stores. These could be Tylenol and ibuprofen for pain or Benadryl for allergies. Even though you do not need a prescription, these medications can still be very dangerous if taken inappropriately. Always read and follow the directions and know that a pharmacist is always willing to recommend a product for you and counsel you on how to take it safely, even if it does not require a prescription.
Prescription medications are not one size fits all. Abuse could be the wrong person, the wrong dose, or the wrong use. When doctors prescribe medications, they consider every part of the patient's medical history. This could include the patient's age, weight, gender, medical conditions, and other medications that they're taking to avoid drug interactions.
Here's a chart on drug abuse among 8th and 12th graders. At the top, or blue, would be recreational drugs, and green would be prescription drugs. As you can see, recreational drugs are the most abused, but there's also prescription drugs up there, such as cough medication, pain medication, and Adderall.
What justification do people give for their use? A, it's a prescription drug, so it is not dangerous. B, it's a prescription drug, so it is not addictive. C, it is legal. Or D, all of the above. The answer is D, all of the above. These are all reasons that people give, but none of these are true. C may have been tricky because the medication themselves may be legal, but if it is misused or given to someone else, it is prescription drug abuse. Taking a prescription drug that has not been prescribed to you or letting someone else take your prescription drug is illegal.
Prescription drug abuse is dangerous. Most prescription drug abuse occurs in young adults ages 18 to 25. Total overdose deaths in 2018 among 15 to 24-year-olds, there was 4,633 deaths. 899 of these deaths were related to prescription drug abuse. For every one of those deaths, there was 17 treatment admissions and 66 emergency room visits.
There are numerous consequences, even if you do not die from prescription drug abuse. These could include legal troubles, which is jail, fines, and a criminal record, school troubles, which could include poor grades or suspension and expulsion, family troubles, which is distrust and arguments, health problems, and addiction.
Addiction is a disease caused by genetic factors we inherit from our families and environmental factors characterized by loss of control, cravings, and continued drug use despite harm. Due to genetic inherited properties in our bodies, every person will react different to different amounts of an addictive substance. For some, a single use is enough to get them hooked, and stopping is near impossible. Having an addiction is not a choice, but exposing yourself to addictive substances is a choice.
True or false? Everyone else is doing it and they don't have any issues.
False. In the past year, only 15% of teens have misused prescription drugs. This means 6 out of 7 teens have not abused prescription drugs. Don't feel pressured to do something you do not want to do. You are more than likely not the only one that feels this way.
This problem is getting worse. Prescription drug pain use has increased from 1 death per 100,000 to almost 10 deaths per 100,000.
How can you help? If you take a prescription medication, never let anyone else use it, even if they are in pain and say they need it. Think of all of the other things you shouldn't share, like a toothbrush. Prescription drugs are just like this. Do not publicly announce what medications you take and where you keep them. Always store medications in a safe place and educate others about what you know.
What if you notice drug abuse in a friend? Some common noticeable characteristics include abrupt changes in weight, aggression, depression, and skipping class. You can do a few things if you notice abuse. Try talking to your friend and pointing out your concern. Make sure to be positive. Do not be accusatory or judgmental. Let your friend know you are worried about them and want to help. If the issue is serious, seek help from a teacher, counselor, or a parent. If you ever see or suspect an overdose, call 911. You will not get in any trouble, even if you are involved due to laws protecting you. Signs of an overdose could include the person breathing slowly, their fingers turning blue, their lips turning blue, violent behavior, confusion, or you're unable to wake them up.
This is a list of some helpful resources that were used for today's presentation. And these are also listed on the flyer that we've attached and sent to your teacher if you guys are interested in that.
Thank you for letting us present to you today. Your teacher may have a worksheet for you to complete to help increase your knowledge about medication safety. Have a great day.